So I'm here today with the lovely Kavi and Jade from Empowered Advocacy. Kavi is an occupational therapist and Jade is a behaviour analyst. And we're just going to talk today all about challenging behaviour, which is a big theme for parents. It's a lot for them to manage when children are having ups and downs in their behaviour. So we're going to get all your expert knowledge today. Okay, so if we start, Jade, why don't you tell us what is challenging behaviour? How would that be seen?
So challenging behaviour we would consider as anything that interferes with a child's ability to learn, to socialise, to participate in classroom routines, and anything is just kind of a barrier in their life. So there's lots of different challenging behaviours that we would see. And with kind of preschool age children, it can be harder to differentiate between what is challenging behaviour and what is kind of typical toddler and young child behaviour. Yeah. So what we would kind of do is we do a lot of observations, some assessment and some data collection to see, is this, a small child coming to nursery for the first time and struggling to separate from their parents, and they're going to kind of move through that behavior quickly and participate in the class? Or is it something that's kind of more persistent, that a child is struggling every single day with coming in, and tantrums are lasting their entire day at school and interfering with their ability to interact with the other kids and learn from the teacher? So we would kind of look there and see, maybe this is a behavior that we would consider challenging. It might need some support and intervention.
Absolutely. So what are some of the common challenging behaviors that you would see in our settings? So when I get in touch with you as a team, what are your main referrals? What's the most popular? And what are they presenting with?
Yeah, I would say with early years kids, a lot of the time we're looking at kind of tantrum behaviors, which can include kind of crying, refusing to participate in particular activities. We would sometimes look at some kids who are having some issues with aggression. So it might be their first time, in a school setting. They're not used to having to share with other kids or
managing transitions. Managing transitions, I see you guys helping with a lot, where they've not managed the transition into nursery and they're not coping with the transition out of being at home and in the environment, and looking at why.
That's separating from parents is a big thing as well in learning. So that's something as well we get referrals for. Even sensory behaviors, and when we look at sensory behaviors, again, we see, like, is it something that's affecting the child's ability to learn? And is it affecting their ability to engage in a routine at home? And that's when we would look at it as a challenging behavior as well.
Absolutely, to the point where they're not enjoying being in the environment or they're struggling. Absolutely. So how would you distinguish between a behavior that's developmentally typical, like we discussed, and those that require additional support? When does it come to the point that they need that additional support from you guys, and say in the environment as teachers, as assistants, we're struggling to get them settled or support them with the behavior they're displaying?
Yeah, I think it's important to give a child a chance, first of all, to settle, to see, is this something that's going to, that they're going to adapt to and move on from by themselves. If we notice that after a couple of months that a behavior is kind of still happening, or a child is having a particular challenge or skill deficit, then I think it's a good idea to have someone come in, do kind of a screening and formal assessment, do some observations, and then try and see, is this, typical, what can be expected, or it is interfering with their kind of ability to participate in the classroom.
Absolutely. And we wouldn't do that straight away. All children, we know 4 to 6 weeks settling time is really important.
That's good that you guys have it. A lot of the nurseries do have that settling in period. And generally 4 to 6 weeks is a good timeline as well, to see if the child is adjusting to their new environment as well. The other thing is also talking to parents, because if it's not just happening in this environment, whether it's happening at home as well, that's an important thing for us to know as well. And then that might show us how persistent the behavior is. Is it happening just in this environment? So is it adjusting to the environment, or is it something that's persistent that happens across all their environments as well?
The role of reinforcement then. So I think we've talked a lot about how you supporting on a more individual basis with children who are struggling with key behaviours or key transitions. How is the role of reinforcement important? How do you use it effectively when you're working with young children, and how do you balance reinforcing positive behaviour whilst also addressing the unwanted behaviour, what we call as unwanted behaviour that's not supporting positive development or interactions in children?
reinforcement is a really important principle of learning. And I think we all use it throughout our lives without even noticing it. So parents at home, from when a baby is very small, they start with smiling at them, giving positive praise. And if we're doing these different things after particular behaviors happen, it's going to increase that happening in the future. So we would use reinforcement anytime a child is displaying a behavior that we want them to continue with. So what we would try and say is, you want to be, we kind of say like an 80-20 rule. So 80% of the time you want to be reinforcing the behaviors that you want to see more of, and then only 20% of the time maybe giving feedback and trying to support on those behaviors that you're trying to maybe see less of. And I think especially with young children, even if there are particular behaviors that we want to try and address and support with, what we would often try and do is find a replacement behavior. So something else that will serve the purpose that they need. So if we have a child who is maybe crying every time the kids go out in the playground because they don't want to go, we would try and teach them another alternative behavior. You know, you can ask for some quiet time, or you can ask to play in a different area, and then we will reinforce that alternative behavior instead. So it's still trying to kind of foster a positive relationship between the teachers and the kids all the time.
Yeah, and I think that's a very important point, because replacement behavior, we can reinforce something, but if the child doesn't know what can I do instead of crying, then it's not really going to work, is it? Because they don't know what else they can do. So teaching those replacement behaviors is something that should be paired with that reinforcement as well.
And sometimes it's a distraction from being upset, because it's normal for children to get upset and cry when they feel unsettled and they don't have communication and language. But it's what can we do to reassure you and give you an alternative, calm you down and make you feel safe. And that's a big part of what you guys are very experienced at. And sometimes when a teacher has a large class of children, having you in can be invaluable, because you can kind of point out and try different things around the teacher in the class, which supports the child to manage their behaviour and also interact and be around the other children in a much kind of nicer way for them. So I have seen a lot of what you do, and it's certainly very, very positive.
Like Jade said, reinforcement is something that everyone does every day, but we don't realise. So sometimes, you know, if we're talking to a teacher or a parent, or say when we talk about reinforcement, they might think, oh God, it's a huge, what do I have to learn now? But it is something that we naturally do. You're doing it. You just kind of have to pay a bit more careful attention to how we're doing it and how much of it we're doing, because we do get busy with our everyday lives at home as well. So you just being a bit more mindful of
more positive praise, congratulating children when they do well, when they manage to take a little step forward in something, lots and lots of praising as well can really help.
Even a verbal comment is a form of reinforcement, you know, like, oh, good job, great job. So even that's a type of reinforcement. So just being a bit more mindful of how we're doing that.
Amazing. So we've kind of talked about reinforcement. What about supporting social skills? Because that's a big area that parents worry. I mean, I see it all the time with parents in the nursery. They worry about it. So social skills are essential in early childhood. How can you as therapists support our teachers to design your interventions to support the development of positive social behaviours like sharing, turn taking, resolving their conflicts, expressing their feelings in a positive way where their point is made and heard by the other party? These are all key elements of a lot of what we do to support children in early years.
Yeah. So there's, like you mentioned, there's a lot of social skills that kids need to learn to be able to participate well in a classroom environment. And a lot of times kids are coming in, maybe they're the oldest child or they're an only child at home. So they've never had any experience with having to share their toys or wait for something that they want. So we would try and come up with ideas to teach these social skills in a fun way. So turn-taking games, maybe with the whole class, or if we identify one or two kids that are really struggling with something like turn-taking or waiting, we could maybe pull them out, do some kind of role playing and practice in a small group, and then try and generalize those skills back into the classroom. We also often use strategies like social stories, where we'll create a story for a specific child, try and use, you know, their family members, their favorite kind of toys, and explain the concept of something like sharing or how to deal with conflict with friends in a fun way, kind of go over it every day with the child so they really kind of remember the things that they're learning and they get to see it in a fun way that's really personal to them.
And I think typically in early years in nurseries and things, the reason you see a lot of the difficulty with social skills is because they're still typically developmentally, they're still learning
Yes.
how to interact with others.
Yeah.
And even sharing is not a typically developmental skill that you would expect until about 2.5, 3 years.
Yeah,
If they're in
sometimes
nursery-
later.
Yeah.
Yes, if they're in nursery before that, it is something that they're being expected to do that is really difficult. So a lot of the strategies that Jade talks about in general in the classrooms will help those younger kids as well. But even at home, parents can do it with siblings. So for example, my 4-year-old, I know she knows how to wait and take turns. So I might pair her with my 2-year-old and play a little game so that she's learning from modeling. You know, she's learning and seeing that my older child can wait. And unfortunately, she is a second child and she does have to share, but there are ways even at home that parents can work on those skills, like using a timer to teach them how to wait for your turn, using those words, or even if they're an only child, some play dates at the playground. So like going to the playground daily so that they learn through experience as well. So they don't necessarily have to be in a classroom environment to learn all those skills. You can, you can input it into their daily lives as well.
Absolutely.
Yeah.
And parents, like you say, being aware that under age of 2, we can role model, but the child's the part of the brain that deals with the ability to share doesn't actually switch on. So
Yeah.
although you're role modeling,
They
it's
still
not
may not
that,
be able to do
yeah,
it.
the altruistic part of children's behaviour really does kick in when they're that little bit older.
Yeah, and if we get referrals where like their main thing is social skills, that is something that we would look at, like what's their age and what is typical. So sometimes we might recommend some strategies, but saying maybe waiting because it may not necessarily actually be a developmental delay.
Exactly.
It's just typical.
It's
of their
normal,
age,
yeah.
and they just need a little extra time to learn that skill.
Yeah.
Because it's difficult for them. They move from age 1 from parallel play, playing alongside each other, to being interested in playing with each other without the part of their brain that allows them to do that effectively being switched on. So that's why you see tussles over toys. That's why you see children struggling to share. It's very much a gradual process. And so we would class that as normal child development, and we would intervene. The point where we would be seeking to work with you guys is if they're getting, 3.5 in these areas are still, areas where they're struggling, or we feel that speech and language is an issue and that their social relationships are affected because they can't. So these type of things. So that's really useful to talk about. So then, what about long-term impact? What long-term outcomes do you typically see in children who you have early interventions with? I know early intervention's key if we're seeing something a parent's worrying about, or us as a teacher if we're worrying. So what do you feel is the long-term impact if you intervene and support children at these crucial stages?
Yeah, so like you said, early intervention is so important, and all of the research out there kind of shows that the earlier a child gets support, the more positive the outcomes are going to be. And I think with different therapies, there's probably different reasons for that. But I think when you're looking at a specific skill deficit, if a child has, say, communication difficulties, the longer they don't get intervention, kind of the further behind they fall in terms of their peers. So the sooner they can kind of catch up and kind of develop some more skills, the quicker that they can get onto a similar level with their peers and then keep developing. And in terms of a challenging behaviour, the longer a child experiences a particular challenging behaviour that is maybe working for them, the harder it is for them to change.
To unlearn that learned pattern of behaviour. Because it gets ingrained. It becomes an ingrained behaviour.
Early intervention is key, because sometimes, I know it's confronting for parents to hear, oh, they're only 2 or they're only 1 and maybe we'll wait, but really explaining the importance of early intervention, because as well, children's brains are so, at that age, their neuroplasticities, it's easier to...
It's like a sponge, isn't it? A big sponge,
They can learn quicker, but when they get closer to 3, 4, when they're ready to go to school, they've already learned those behaviors. So that early intervention is key, and it might be the key to, they might have a developmental delay, but the long-term effect is once they get to 3 or 4, because they've been working on those skills, they may not actually have that delay, so getting that early intervention is important.
It's in which type of intervention as well, because sometimes we might start with speech and language and then think, actually, yes, there's an issue with speech, but we need to look at a different type of therapy, because it might be that the speech is being impacted by something else going on. And that's why the varied nature of your team is really good, because you've got different types of therapists. You've got speech and language, occupational, ABA trained. So you guys have a really good balanced approach to working with a child.
Yeah, it's a holistic approach, isn't it? Because you might, speech therapists look at one area plus some underlying skills. Behavior therapists look at those challenging behaviors. So, and occupational therapy looks at developmental skills. So, if you have a multidisciplinary approach where everyone's working together, you'll not only work on the surface skills, but any underlying skills that are missing as well. So,
absolutely. And I think as well, for us as teachers, it's really crucial to work as a team. So what we try and do here at EBN with your support is have meetings with the parent, with the therapist, with the teacher, and then having an action plan and an individual education plan drawn up both by yourselves and the nursery. And that really helps work on key areas. That's what we can do for some children. And then other children, it can just be short bursts of support or referrals for a key area or a key stage that children are dealing with.
I think that was the ethos behind Empowered Advocacy is working in schools. So not just having a separate clinic where you have the children come in separately, really collaborating with the schools. And the unique opportunity that provides us is being able to come into the nursery and do the session. So the teacher can see as well. So, if the teacher needs some assistance or some help to understand how to work it in the classroom, we're on site, and that's collaborating with the teacher. They can do the session in the class or out of the class to kind of help that collaborative approach.
And it really does work. The impact is much better for the children because the teacher is working in line with what the therapists are recommending, and at home parents are supporting too. So that unified approach really benefits the children here at
and
EBN.
it benefits the child as well because it's in their natural environment. We're teaching everything within the environment that they're having that difficulty in. So
and like you mentioned, at home as well is so important. And I think sometimes in early intervention programs, that step is kind of missed. So it's related with maybe the school and the therapist have a plan in place. The child is doing well, but then they go home and it's a completely different story there.
Different environment.
The parents maybe haven't been trained on the strategies that are being used in school, or the caregivers at home. So involving parents in that team is so important because kids spend the majority of their time with either parents or caregivers at home. So having them kind of equipped with all the skills that they need to help the child learn is super important as well.
I think you've gave us a really good understanding of how to support children in early years environments, and we really appreciate it. So thank you so much to Kavi and Jade for coming today. And if parents want to get in touch with you, they can contact you either through the nursery or through the website Empowered Advocacy.
Yeah, if they just do a Google search of Empowered Advocacy, you'll be able to get in touch with us.
Thank you so much. Thank you.
Thank you so much.